Councillor Perks.
Thank you, Mr. Chair. To begin with, I want to move a motion that the Board of Health request the Medical Officer of Health in consultation with the City Solicitor to provide a summary for the January 2025 meeting of the Board of Health of any legal issues related to the provincial decision to close safe consumption facilities in Toronto. And 2, request the Medical Officer of Health in consultation with the Chief of Police, the Toronto Police Service, the Fire Chief and General Manager, Fire Services, and the Chief Toronto Paramedic Services to provide a summary for the January 2025 meeting of the Board of Health of likely service impacts related to the provincial decision to close safe consumption facilities in Toronto. So I'll talk to each of these and some additional comments. First, it is worth remembering that the Supreme Court of Canada ruled, I think about 10 years ago, when the federal government attempted to close safe consumption services in British Columbia, that it would be a violation of the rights to equal access to health services to close safe consumption sites in British Columbia, that governments are not allowed to arbitrarily remove health services from a particular group, which is exactly what Premier Ford is doing here. He may not have described it that way, but that is the point. So I think getting a little bit of advice, it may have to be in camera, I don't know, but getting a little bit of advice about that might be helpful. As to the others, members of the Board of Health might not know this, but over the last couple of years, the City of Toronto has been struggling with response times to 911 calls. We actually had work done by the city's Auditor General showing that there were real problems. And there are many different factors that played into that. One of them was the entanglement of all emergency services when an overdose call came. All services responded. So there's been an effort to try to have that be a health response rather than a police response or a fire response. That disentanglement has started to show some improvement in the response times of fire and police. That will be completely wiped out, and we will be in a worse position if the thousands of overdoses that are reversed every year at safe consumption sites suddenly become the responsibility of our first responders. Now, it shouldn't have to matter. It should be sufficient just to say that people who use drugs are at risk of dying. That should be sufficient, but it isn't. We have to explain to people how this impacts everyone's health and access to emergency services. The final thing I wanted to talk about, and it's not part of my motion, is this idea that the heart services are somehow a replacement for safe consumption services. As Dr. Davila's predecessor said when we were considering creating these services, he hoped that if he had a family member or a loved one who used drugs, that they would seek treatment. But more importantly, he would hope they stayed alive long enough to get to that treatment. It's awful to say, but you can't treat someone who's dead. The fact of the matter is that for each person, there will be a time when they're ready to seek treatment. And you have to have those services ready for when they're ready to seek treatment. And we don't in Ontario, that's clear. But to say that we're not going to help them stay alive until they reach that decision is, as members of the public said, murder. It's as simple as that. So, as we've heard you, we're going to keep fighting. The recommendations already in the report say that we should continue to fight. I wanted to add a little bit more so that we can reconvene in January, perhaps with some advice from some of the city departments that are going to be dealing with this to continue our fight. This is a fight we must win.
Thank you.